Hi, Paul Slatkus. We're going to talk about a very important, some new thoughts here with regard to early stage lung cancer. Okay, progress in diagnosing and treating early lung stage cancer. We have Dr. David Carbone, who's a professor of internal medicine and director of the James Thoracic Oncology Center at Ohio State University Medical Center. And good morning. Hi, how are you?
I'm good, Paul. Thanks for having me on.
Well, this is very important subject. Lung cancer, cancer of any type is extremely important, and early stage detection. Well, tell us what some of the things you've learned. This is great. Thank you.
Well, lung cancer is the number one cancer killer of both men and women in this country, but really the American Cancer Society has just determined that we've doubled the survival for lung cancer in recent years. And this is due to a lot of factors, advances in the types of treatment we have, genetic understanding of the tumors, but also an increasing number of patients that are detected in the earliest stages when it's most curable by surgery. So that's what we're here to talk about today.
Okay. All right. Please share.
So lung cancer, early stage lung cancer is generally considered to be the stage in which it's possible to do surgery and have the tumor completely resected by a surgeon. But unfortunately, unlike many other types of disease, lung cancer, even when it appears that you've removed the entire tumor, there's about a 50% chance that that cancer will come back and kill the patient. And this is really unacceptably high. And we've worked for years to try to improve on that number. The only thing we've found, and this was decades ago, was that chemotherapy improved that by a little bit. If you get a few cycles of chemotherapy after surgery, you improve the chances of you being alive at 5 years by about 5%. But very recently, we've been able to apply immunotherapy, and specifically etizolam, after chemotherapy and after resection of early stage disease. And we're partnering with Genentech in this presentation to disseminate information about this newly available treatment. Now, of course, these treatments have side effects, and they should be discussed with your doctor. And these treatments are also not appropriate for everybody. There are certain markers you need, certain stages that have to be the situation before this becomes appropriate. But this is really exciting that we now definitely have another modality that can reduce the chance of this cancer coming back after surgery.
All right. Question number one. What's immunotherapy? What does that mean?
So immunotherapy is different from chemotherapy and other types of cancer therapy in that the point is to induce your body's own immune system to fight the cancer. And cancers develop ways of avoiding the immune system in order to grow and become a clinically evident cancer. But we've discovered some of those ways that cancers use to avoid the immune system and been able to target them with specific antibodies against a pathway called PD-1. And atezolizumab is one of those types of treatments that's been shown to be very effective and not just increasing outcomes by a few weeks, but really very durable benefit with these treatments and very reasonable side effect profile, where I would say most patients have no side effects from this treatment.
I might have to ask you to say that word again. Atezum. Okay, help me here, Doc.
Brand name. Atezolizumab, and I think they intentionally make these names complicated for some reason that I'm not clear on.
That's okay. Well, because if somebody really wants it, they're going to figure out how to spell it and how to find it. Let me ask you. So, what will that do? What will that do? And it's made up of what? How does this possibly or not? How is this helping?
Well, this, as I said, the purpose of this, first, the patient needs to have effective surgery, and they need to go to a specialized lung cancer surgeon and have state-of-the-art surgery. That's very important. And then chemotherapy, as I said, is known to improve survival. But now patients should discuss with their doctor that there's a new recently approved treatment with this drug, etizolam, that can be used after the chemotherapy and has been shown to decrease the chance of the cancer coming back. So really, this should be a discussion the patient has with their oncologist as to whether this is appropriate for them.
Okay, I'm sure we'll see it on TV in a commercial form.
Probably so.
But let me ask you one other thing. This is a naive question, but an important question. What is cancer of the lungs? What is it? What happens?
Well, in cancer in general is just a derangement of growth of normal cells. Your body is made up of billions of cells, and each of them grows when it's supposed to and stops when it's supposed to stop. But a cancer generally has damage to some of the genes that regulate this growth and enable that group of cells with that damage to just continue to grow out of control. And these cells, once they acquire that damage, invade adjacent structures in the body, and pieces of the tumor can break off and go to other places in the body, which makes cancer very difficult to treat because it's basically your own cells, very similar to the rest of your body, but with a small number of key changes that make it lose normal growth controls.
And we don't know which ones, and we can't get specific enough, or we can't protect them, or we can't.
Oh, we do. We actually, one of the major advances in cancer treatment is understanding at a molecular level the specific types of damage that result in cancer. And lung cancer is the poster child for this, where we now have 10 or 12 specific genetic abnormalities that can result in cancer, for which we have specific drugs to target them, and that cause high rates of response with low toxicity. And these are called targeted therapies, which are really different than the immunotherapies we were talking about before. But I think science really has led to the development of both these genetically targeted therapies and the immunotherapies. And we use them based on specific patient characteristics that are determined through what's called biomarker testing of patients' tumors. So it's not a one-size-fits-all kind of thing, and every patient is treated as an individual patient.
Aha. Well, with genentechs and pharma companies that are spending a lot of money to do research, and the trial people, the people that actually come out and do that, they're all heroes in their own way, right? I mean, this is serious.
And the patients that participate in these trials are heroes, because the clinical trials of today are the standard of care of tomorrow. And we only get there through these clinical trials.
And if somebody wanted to be in a clinical trial, they look up, or their doctor knows about clinical trials. How does that happen?
Well, doctors are variably aware of clinical trials, but there are some excellent online resources that are available. And the ones that are specifically patient-friendly are often the advocacy foundations, such as the Go2 Foundation with the number 2 in the name, but also Longevity and Lung Cancer Foundation of America. There are several of these that have very patient-friendly interfaces. But it's also not a bad idea to get a second opinion at a major academic center. Your doctor may be recommending exactly the appropriate treatment, but to have that confidence that you're getting the best possible care and that you are aware of the best clinical trials that are available, a second opinion at a major academic center is never a bad idea.
A quick question. Since you've been doing this, I'm sure a few days. Is smoking more than
Like
50%?
5 years.
Is smoking 50% of the concern here that occurs that hurts these cells?
If you have lungs, you can get lung cancer. But the majority of patients who get lung cancer, about 85% of them have some smoking history, but many people don't have any smoking history. But actually, more than half of patients diagnosed with lung cancer today have quit cigarette smoking. So it is important that if you have an exposure to cigarette smoke, that you seek out lung cancer screening, which is now available, and it can improve the detection of early stage lung cancer.
Okay. And does Genentech have a website that we can send people to for that? What's it called again?
Well, I think the foundation websites are the ones that are most patient friendly, and the gotofoundation.org is one I can recommend.
All right. And the name of that drug that we were talking about?
Etizolam.
Thanks, my friend. All right. Go
All right,
Buckeyes.
well, thank you.
Thank you. Bye-bye.
Bye, guys. Thank you, Paul. Bye.
Bye.